Welcome to NDTR Spotlight, a show where we highlight former and current NDTRs. And NDTR, if you don't know, stands for Nutritionist Diet Technician Registered. They also go by the credential DTR, which stands for Diet Technician Registered. In order to become an NDTR, you have to graduate from an accredited program, take an exam, and participate in continual education.
Welcome to NDTR Spotlight. I'm your host, Marie Lorraine. Today's guest has been a DTR since 2019 and just recently got her master's in human nutrition and completed her dietetic internship. So this is an interview to watch if you're thinking about using the NDTR credential as a stepping stone to become a dietitian. And I connected with this DTR on LinkedIn. She celebrated her work anniversary with a little post, and I commented and asked her if she wanted to be spotlighted, and she so graciously agreed. So I'm super excited. Lorena, thank you so much for being here today.
Hi, you're welcome. Thank you so much for having me.
100%. So how did you find out and what made you decide to pursue that NDTR credential?
Yes, so when I was finishing my undergraduate degree in the university, I was told that, that you can take the exam, sign up for the exam. And that's one of, things I had in the back of my mind to take the exam and become an NDTR. But it was until I started looking for a job that, some jobs require to have NDTR credential, not just a bachelor's degree. So then I decided to have that. It was required also for my job to have that credential. So I took the exam after graduating.
That's cool. I like when there are jobs that require that DTR credential because it just pushes you to go a little bit further. So what position did you hold as a DTR?
So my position was a dietetic technician in a long-term care, rehabilitation center. So that was my job title.
Nice. How was that experience in going from undergrad and the BS to going right into working in the field?
Well, when I was going through the undergraduate, schooling, actually I was working. So I wasn't the traditional student. I had my family, I'm a mom, and I needed to have an income. So I enrolled full-time in school, but I had to work. So I actually had different jobs during my career, when I was going to school. It wasn't really nutrition related jobs. Mm-hmm. And then, when I finished the school, that's when I start looking to getting more involved in nutrition, since my main goal was to become a registered dietitian, and I needed to put myself into that, more like just connect more with my profession and what that entails.
Yeah, that makes sense. So I know you had the bachelor's degree in dietetics. So what made you decide to go and get the DTR credential as opposed to go right for the dietetic internship?
Well, to be honest, as I mentioned, I wasn't a traditional student, so I had not really much experience in nutrition when I applied the first time for my dietetic internship. And then, after like evaluating, I said, why I didn't match the first time I tried after school. Yes, I needed to have more. I didn't really involve it. I was involved in anything in school, like, a lot of students with the nutrition club, the lab, or anything, that I can actually help you to get matched the first time. And it wasn't something that I had. So even though I have a really good professional life experience, I didn't have a specific nutrition related experiences in my resume. And that's resulted in me not being matched. So after that, I said, well, let me reevaluate. What do I need to do to continue with my goal? And actually, I'm very happy that the way everything, turns out to be. I, work as a DTR. I work as a weight nutritionist. And those were experiences that actually helped me enrich my profession, and I understand a lot of parts of nutrition now, that all the pathways that you can take as an RD. And that was really positive for me.
Yeah, I love that. You kind of already touched on my next question, that need for the nutrition experience is sometimes a little daunting and frustrating after you just complete all this schooling. But how can you talk a little bit more on how it impacted your experience during your dietetic internship and just your perspective of the field?
So it is a different perspective when you have a nutrition career, you live in a school, and then you are, okay, what do I do with my nutrition knowledge? All the schooling, right? So then you can go the path of counseling, which is totally different than being in clinical. So I wanted to be in clinical. With my NDTR, I wanted to work in a facility that allowed me to understand what nutrition can help patients, and in many places, like this long-term care, and what nutrition is so important for these people. And that's what I wanted to do. I wanted to be in nutrition in a clinical setting. I understand, the relationship of, how can you impact positively in these people's health with your nutrition knowledge. And that's what I wanted to do. Did I answer your question?
Yeah, so that you found that long-term care. So specifically, did you feel that you had more confidence or were more comfortable doing your dietetic internship, or was the experience just a way to get matched into a dietetic internship?
Well, no, I actually helped me the two ways. Helped me to match and helped me to understand and be a better intern. So when I went to clinical and a hospital setting, it was a familiar setting for me. The terminology was very familiar. The dynamics between, the food service facility, dietitians, nurses, and doctors, and how all the departments interconnect and communicate, it was very familiar to me. And it helped me to feel comfortable, confident in what is next for me now to learn. And it actually helped me, and I really loved that I had that experience.
That's awesome. That's good to hear that it wasn't like a wasted years. It added to your career and enhanced your resume. So the master's degree is required for dietitians in 2024, I think, if that's the right date. And you have yours. Do you think getting your master's degree as well as that dietetic internship was worth it? Did you enjoy the graduate work that you had to do along with the dietetic internship?
Well, yes, I did. I would say, a little fortunate that, I'm sorry if this is gonna sound crazy, but that I have kind of a break because of COVID. So I was able to complete some of my classes from home, and I didn't have to go to the internship because it was put out on hold because of the entire thing what happened with COVID at the beginning of last year. So I was spent a few months, at home doing the master's work. And then when I was ready to go back, then yes, it was a little overwhelming because I was doing my clinical and I was doing my master's and studying. So there was a lot, but yeah, it was worth it. It was really great to know that that was going to be my last semester, finish on my internship, and then just 2021 was going to be this nice break, like done. I'm done year.
Yes, yeah. Well, almost. We have to ask about all of the tests that you have to take in this field. So how was studying for the DTR exam back in 2019? What was that like for you?
Yes, well, in 2019, so when I had to study for the exam, basically I had, a lot of, first of all, I have a lot of people that were supporting me, and they were like, oh, sharing information with me, like what should I be studying for the exam? And basically what I did is I purchased the academy, the nutrition academy of the binder with all the guidelines and, kind of the practice questions, exams. So that tells you, what to study, what the domains include, and actually helped me to kind of like said, okay, this is what I need to do, and then put a schedule for me to what I need to study. And by taking the questions, the practice questions, then you understand what your points are, your strong and the ones and your weak areas. So you concentrate on your weak areas. So for me, it was a lot of the management theories, a lot of the management concepts were really like, oh, I can't get this in my head. So that was one thing that I concentrate my energy on. learning about, the food service also was another concept that was very important, that a lot of concepts, like temperatures, and, you concentrate your energy in the things you need to memorize. So I will definitely recommend, if any exam, if you need to take, just kind of use a guide and go with the practice questions and assess yourself, assess your knowledge, and be very true to yourself, what things that you need to learn, and concentrate most of your time learning those topics. And then that you are, in a good path to pass the exam.
Yeah, that's good advice. How long did you study for the exam?
Oh, well, I honestly don't remember exactly how long, but I did remember I was studying for the exam mostly weekends, and like the weekends usually was days that I would just sit down and not leave until I was done with everything I needed to work, because I was in a full-time job during the week. And then by the time I was done, I just come home, and you need to, take care of your family, take care of yourself. And then there was really no energy for me to continue doing anything. But on the weekends, I will get up early, and then we'll say, okay, this is my study time. And I will study as much as I could on those weekends until the day that I was ready to take the exam. And even the day, I think I studied until the last day that I had to take that exam, that I was just sitting and I was just, okay, let me continue reviewing those management concepts. I went to school, went back to the library and the university, which is very close to my home. And I got the book, and I was just sitting there, and let me just review those concepts that are important in the book, and taking notes. So then that's what, just use the time that you have as much as you can. Just be, sometimes you're busy, but if you can just schedule those chunks of your time to just concentrate on your studying, it's very important when you're busy.
I love that response. A lot of people usually just give like a month span, but just like putting that to the weekends and not feeling guilty about that, and putting self-care in your family during the week. I love that response and how you studied. So with that DTR exam studying, how do you plan to study for your dietitian credential in that exam?
Yes, well, I'm currently studying from the exam for the RD exam. So doing the same thing. I assess my knowledge with practice exam questions. And I know, again, one of my areas that I'm the strongest. So I move on. I'm not saying, okay, I'm going to forget about it and I'm a master. No, but I'm not going to concentrate the majority of my time reviewing the topics that I'm confident enough that I'm okay. Mm-hmm. So then I'm just going to concentrate my time on the topics that matters the most. So I have prepared. Yes, this time I'm prepared. That, what are the days that I'm going to be studying, and my schedule during the day, how many hours I'm going to do, my domain first, my second domain, and then till I, continue basically completing my entire study guide, which is, I don't know yet when I'm going to take the exam. Mm-hmm. I'm still waiting for my dietetic internship to send me the completion certificate, and, I can't register for the exam. But in the meantime, I'm just studying and, reviewing the concepts that are important. So compared to when I took the NDTR, I heard, I'm not sure, I don't know, that the exams are pretty similar. The domains are different. And I know with the RD credential, they're more deep, like questioning, like you want to know more than your rationale in the topic. But I'm confident that I went through the NDTR exam, now the RD, that at least that environment is familiar to me. I did it. I know that I need to somehow, if there's the letters that are really like, I can read it. I need to read it. I need larger font. I have a calculator. I know what to expect. So that keeps the anxiety really low. Mm-hmm. And I have already my NDTR notes that I love, that I kept them. I'm so happy I kept them, because I remember that I spent an entire day reading the management book, and I have the notes. So I'm like, yes. So I'm going to go back again and review those notes. And one thing is, like, if you're planning to, be an RD, don't get rid of any of the things that help you to be in your position. help you to be an NDTR. Just keep them in there. You know, you never know when you're gonna need them.
Yeah, that's so good using that DTR study material as well as your RD material. And I've heard from a diet technician who became a DTR became a RD that the tests were similar. So I've heard the same thing. So I'm excited for you to take that exam. So in your experience with being a DTR, I know you were pursuing that. You always had the RD credential in the back of your mind, but did you find anything that was frustrating or a little bit annoying about just holding that credential, the DTR credential?
Well, one thing that it was a little frustrating, I would say that it was not a lot of jobs that you can go and say, you know what, I'm gonna go another job, another NDTR, that they require the NDTR credential. There's not a lot. And it's a lot of diet tech, which is not a dietetic technician register. With all respect of the diet tech, it's not, you know, as well as pay as a dietetic technician, because, you know, you need more schooling. So that was the frustrated part for me, like where I can go and, you know, find a job that I can use my credential and get a decent wage. You know, my pay is gonna be a little better. So, and I was very blessed that I actually was hired in this facility, long-term care facility, and the pay was, you know, I would say good. And I had the opportunity to apply the NDTR credential and use that. And everybody knew that I was a DTR. You know, it was really cool because you went to school to put all this knowledge in your career, in your job, and then you being respected and you being valued. And I don't think there's a lot of jobs like that out there. That's one of the things I was very frustrated. But you know, yes, there are, but you just need to find them more detail. You need to be very diligent on finding those jobs that are going to take you to that next level.
Yeah. So you said you worked at WIC and long-term care. What was your strategy to finding work as a DTR?
So my strategy was, I had my connections from school that they were working as diet techs in a hospital. So I apply, and yes, I was hired there. And but then I noticed that the diet tech, it was not dietary technician register, so it was a little different. So while I was working as a diet tech, I said, well, I think I can do a little more with my knowledge and my career. So let me find that next job. So I went to find an NDTR job, and then I started, you know, working there. And that was my strategy, is like knowing what I want to do. By knowing what your current situation is, what is your goal, and what is your next step that's going to take you to your goal. And I used, you know, so for me to get to my goal, I needed to find a job that's going to push me to that next level. And that's what I did. So diet tech, then I went to practice my NDTR. And then after that, then I went to work for WIC. So it was like every single thing, I said, it's going to take me to my next goal, to take me to my goal. So that's what I did.
Yeah, that's so awesome that you were humble enough to take that diet tech position, but then didn't stay there. You kept working. I love that advice to follow that goal. So those two jobs you had, long-term care, WIC, or three, and then diet tech, how was the process of applying to the dietetic internship while you were working as a DTR?
Well, when I was working as a DTR, I said, well, I want to just kind of have enough time that I feel is strong. Like I know that I can do this job with my eyes closed, you know, just an exaggeration. I want to have that experience. I want to feel confident in my job. And that's what I said, how long do I need to feel that confident? And I took, you know, probably a little bit more than a year. And then I said, well, what is going to be my next move? Do I want to apply for the dietetic internship yet? I said, well, maybe not yet, because I want to have more. And that's when I decide to just maybe find another opportunity, another job that is going to give me another set of experiences, or like tools in my toolbox. And it's going to say, okay, now you're good in this job. Now what is next? You know, because remember, I was my RT was my goal. I could have stayed doing NDTR and a long-term care because I love that. It was a really good, fulfilling job. But I just decided it was probably a good move for me to just get another set of experiences. You know, did
Yeah.
I answer your question?
Yeah, beautiful. That was such a good, I loved it. I loved it. You kind of did a little internship before your actual internship doing long-term care or clinical and then community. So that, and then you also did food service. You kind of had your own internship before you had your actual internship, which I think is awesome and probably just helped you excel so much in your internship.
I think you're right. That's how I saw it. I saw that as a mini internship because I'm going to be honest with you that when I left at the dietetic, I didn't do any of the things I did in my NDTR job. So I didn't really have experience. I didn't know a lot of the things. I didn't know how to put a note in the electronic medical record, like, how to put all the things, all the pieces of the nutrition care process in a note and use, the template. So I had to learn a lot. And that was the things, it was a great thing for me to get through this because I was an eye opening. I said, oh my God, this is what I needed to do. It's not just me answering the phone and asking a patient, what do you want to eat? You can, or yes, I'm going to send you this. It was more. It required more thinking, more skills. And that's what I love about this move that I did.
Yeah. Yeah, and I think you kind of hit on one of the things that I personally like about this field is it's so diverse in what you can do. But with that, the diversity is sometimes lacking in the ethnicities that are DTRs and in the genders. So could you speak a little bit to your experience with diversity? Any way you want to explain it or talk about it in this field of dietetics that you've experienced?
Yes. Well, what I noticed when I was going through my career and also towards my life experience, that there's not a lot of nutrition professionals up there that that speaks another language. So
Mm-hmm.
I live in an area that is, I would say, like a high number of people of the population that speaks Spanish only, that understand little English, or that they prefer speak Spanish. And I noticed that in my own family, like my dad, he speaks Spanish well enough for him to just living in a society, but for him to go to the doctor and get a paper that it says this is the diet you need to follow and go home with that, and nobody else taking the time and explain him more, it actually made me think, like, yeah, maybe there's a need for a nutritionist and a dietetic technician register, an RD that speaks the people's language and help this community that needs. And that was one of the things that kept me going, because I said I want to be that RD, that NDTR that can help this other part of the population and be like, let me help you, let me explain you a little bit more how that, what you need to do to improve your health and your own language. So there's not a lot, and I've been thinking that why there's a lot of, I would say Latina, Hispanic women going to nursing, other careers, and not a lot going to nutrition. And it's something that I can't find an answer, but I'm very happy that we will be a good representation of the Hispanic community in the nutrition field, and hopefully continues growing, because that's something that should, the career, I don't know, there's a lack of including more diversity. I just don't know what is happening, but I'm very hopeful that in the future we'll see more diversity. We see more men in the career, see more, women of color, and it just, I would love to see that in the future.
Yeah, I 100% agree with that. I think that that language barrier in healthcare is so crippling to, getting the interventions actually executed well by the patients. So I love that. I love that that kept you going. And I know for a fact that that's going to make a patient so happy. I had the opportunity to work with a Hispanic population, and I don't know Spanish very well. And I knew if we had a Spanish-speaking dietitian in that WIC facility that I was working at, it would have been so much more refreshing for our clients and participants. So I love that you have that in your heart, and that like moved my heart. So thank you. And I hope that people seeing you and seeing what you're doing and seeing that you were able to, complete all this schooling as a mom and a family, a wife, and not a non-traditional student will encourage other people of color and specifically Hispanics to, pursue this career because it's an option for them. And I think representation really is important. So yeah.
Yes.
That's awesome. So, how did you do continual education for your DTR credential, and how do you think you're going to do it as an RD now?
Yes. So let me tell you this. I do continue education a lot because I like to learn. But I'm gonna be honest. I haven't entered all that nutrition, those continued education credits and the tool CDR. Like, said, okay, I took this 3 classes. I'm gonna put those 3 classes as a continued education requirements that you have to meet in the end of the period. I think it's 5 years, if I'm not mistaken. Yeah. So I haven't really doing it because when I call CDR and I actually asked them a question. Hey, my goal is to become an RD in the future. I want to put those continued education credits, but are they going to be continuing or going to be roll over for them when I'm an RD? Can I continue using them? And they said, no, when you're an RD, you start from 0. I said, okay, well, then I'm sorry, I'm not going to put them in there. I didn't do it.
Yeah,
You can't.
that's actually good to know. I didn't know that you started from 0 when you got a new credential. So thank you for sharing that. I think that's going to be a good tidbit for our audience just to have that knowledge. Yeah.
Yes. So I basically said, no, I'm not going to do that because it's work. I mean, it's just, it's just like going there and put what you continued education credit was about, how many hours, and it has to go for approval, I believe. I just didn't do it. But, continuing education is very important in this field because there's always some new things coming out, and you always need to continue educating yourself and what is the last, research and in the environment in a specific dietary part. And, you just have to always continue studying.
It's always changing. And you definitely had all those continual education credits with your master's. So you definitely have your continual education for this time period. So with that in mind, are there any resources or websites that you find very helpful for that idea of like looking up new research or staying up to date with things in your practice?
Yeah. So one of my favorite websites that I used, well, I subscribe to the JAMA network.
Mm-hmm.
Basically, you get a lot of information, like little snips of, what is up there in terms of medicine, the medical research of anything that you need to know. Like, especially with COVID now, there's a lot of things with COVID. So it just gives you a little bit of what is going on. And also one my favorite is the New England Journal of Medicine. You get case studies in there that you learn from. You get, the research, the latest research paper in a topic. Not necessarily nutrition. Sometimes you see nutrition related topics there, but just in general. And you can just read like brief summaries and what's going on and keep yourself knowing what's, up there. And also subscribe maybe to an app that you like. Like I like this app. What is that? ViewMedi. It's ViewMedi, where you get little lectures also on topics. So you subscribe to that, and then you get always a reminder. This one, for example, it says Dr. Fauci and COVID-19. Things like that. So you just watch little 15-10 minutes of something that a health related topic that is trendy, that is, current. That's how I like keeping myself, informed. Also go to anything. I mean, it depends on what you like, right? What you like to learn about. So you like the clinical nutrition, you like counseling, you like sports. So then always find those sites that, always have the app in your cell phone, have it in your computer. and subscribe to newsletters and things that's going to continue send you information about the topic of your interest. So I like going to the diabetes association because there's always something about diabetes. I have my long-term goal after I'm become an RT is to become a certified diabetes educator. So I have that app too in there that sends me things, and then I'm prepared that, okay, I'm going to take that exam in the very, I don't know, future. And I subscribe and I read and always go to what you like, I mean, if this best use of your time, I mean, you can't learn everything, but concentrate on the things that you want to be more proficient, more successful, and more knowledgeable.
That's really good advice. That makes continual education a little less daunting and more interesting and fun. And then, take advantage of technology to send you things so you don't have to just scroll through the internet or research articles or what are they called? Databases for a while. So that's super helpful. Well, Lorena, is there anything you want to share before we close out this interview for DTRs or people thinking about becoming a dietitian?
If you're thinking to become a dietitian, yes, take advantage of your current credential as an NDTR. I loved it. Use it. Find the jobs that is gonna enhance your knowledge and gonna allow you to practice that knowledge. You went to school for so long to learn a lot of things, but if you don't put them into practice, you're not going to, basically do it yourself as a favor. You need to practice them, practice the skills. Not only it's gonna give you more experience, it's also gonna make you love your job more. And enjoy being an NDTR as long as you want. And if you becoming an RD as you go, that definitely is gonna help you because you're not only gonna learn what is that nutrition entails and a lot of levels, it's just also gonna give you more confidence once you are ready to apply for dietetic internships and be in a hospital and a food service facility when you're going to feel that you like a deja vu. Oh, I did this already. And it's going to be better for you. You're going to feel more relaxed and more engaged.
Yes, love that. Such good takeaways. If you are thinking about being a dietitian, I hope that you got a lot out of this interview. To follow your goal, let that goal keep you moving. Don't stay stagnant. Don't get stuck. If you enjoyed this interview, please give it a thumbs up. Comment down below one thing that you took away from Lorena, and hopefully we'll see you in our next interview. Thanks so much for watching.